two gametes of sexual reproduction are sperm and egg. Did you notice the large size difference between the sperm and the egg? There's a reason for this, but let's see how their formation differs from one another first. The creation of sperm is called spermatogenesis. It starts with a diploid cell called a primary spermatocyte, and after meiosis I, it forms two secondary spermatocytes, which are haploid, but have a duplicate chromatid with them. After meiosis II, all the cells are haploid, which in humans means they'll have 23 chromosomes. The haploid spermatids will mature into sperm, which will then be motile and ready to fertilize an egg. The creation of an egg, also known as an ovum, is called oogenesis. Like spermatogenesis, will start with a diploid cell called a primary oocyte. But after meiosis I, the cytoplasm is divided unevenly, and one cell gets most of the cytoplasm. The cell with the most cytoplasm is called the secondary oocyte, and the other small cell is a polar body. Both of the cells are haploid, with all chromosomes duplicated. After meiosis II, the secondary oocyte is again divided unevenly, and most of the cytoplasm goes to the ootid, which will mature into an ovum. This ovum will have all the organelles, including the mitochondria. Even though only one mature ovum is created by the one oocyte in oogenesis, females are still born with millions of cells and will release hundreds in their lifetime. Not every cell created by one individual is the same. In fact, they're all very different. Genetic recombination from crossing over and independent assortment during meiosis lead to genetic variation and differences in each sperm and egg. This is why brothers and sisters don't all look identical. Now, the whole point of making sperm and egg is for fertilization, to make offspring, babies. Once the haploid set of chromosomes from the sperm are released into the egg, the two sets of chromosomes combine, creating one diploid zygote, which will grow and mature over time into the offspring. We all started out this way, just a tiny cell the size of a grain of sand. But sometimes things don't always go so smoothly. Errors during meiosis can cause non-disjunction. Non-disjunction is a failure of homologous chromosomes or sister chromatids to separate during meiosis. Here's one of those cases. During metaphase I, everything is lined up as expected. But during anaphase I, a chromosome is pulled to the wrong side, which leads to gametes with incorrect numbers. Some will have an extra chromosome, and some will have one less. This could lead to a variety of issues. While most of these cases will lead to miscarriage, some disorders are not life-threatening. Here are some examples of disorders that can occur as a result of non-disjunction. Probably the most widely known one is Down syndrome. In this case, there's an extra 21st chromosome, which can lead to mental impairment and stunted growth, among other things. Klinefelter syndrome occurs when there's an extra X chromosome in the standard male karyotype. This can lead to weaker muscles and bones, less testosterone, and sterility. One of the only cases of monosomy, where there's one less chromosome, is Turner syndrome. In this case, the second X sex chromosome is missing. The female will be sterile and have shorter stature and a webbed neck, but might not have any mental impairments. Thanks for watching this episode of Teacher's Pet. Don't forget to like and subscribe, and follow me on Twitter at SciencePet.
Methods. Condoms. Condoms for men are thin rubber tubes that cover the penis. You can buy them at supermarkets and pharmacies. Each condom can only be used once. Female condoms are tubes that can be inserted into the vagina. They're harder to find than male condoms, but you can get them from family planning clinics, some pharmacies, and on the internet. Again, these can only be used once. Condoms help avoid pregnancy by trapping the white fluid containing sperm that comes from the penis during sex, so that it does not touch the inside of the vagina. Be aware that condoms are the only contraceptive method that can also protect you from getting certain infections during sex. Diaphragms. The diaphragm is a cup-shaped device you can get at pharmacies. It sits inside the vagina, covering the opening of the uterus, that is, the womb. Before first use, it is best to have a doctor or nurse check that it is positioned properly. IUD. IUD stands for intrauterine device. There are two types. The hormonal IUD contains a safe chemical called a hormone in a small piece of plastic. It can last for 5 years. The copper IUD contains a piece of copper, a type of metal, instead of hormones, and it can last up to twice as long. IUDs are inserted in the uterus and are removed using the string by a specially trained doctor or nurse. Your fertility will quickly return when you remove the IUD. Contraceptive implant. The contraceptive implant is a small soft plastic stick containing a hormone. It is inserted under the skin of your arm by a doctor or nurse and can last for 3 years. Your fertility will quickly return when you remove the implant. Depot injection. The depot injection is a hormone fluid injected into your buttock or arm. It can last for 12 weeks. Contraceptive pills. Contraceptive pills are medications containing hormones, which need to be taken every day. There are two types. The combined pill, usually known as the pill, has tablets containing 2 hormones. The mini pill contains only 1 hormone. Talk to your doctor about which medication would be the best option for you. Your fertility will quickly return when you stop taking the pills. Vaginal ring. The vaginal ring is a small soft ring that contains 2 hormones. Placed inside the vagina, it can last for 3 weeks. Your fertility will quickly return when you stop using the vaginal ring. It's important to know that all of these hormonal methods of contraception might change a woman's period and cause side effects, so speak to your doctor. Natural family planning. Natural family planning is where people use calendars or programs to try to guess when they can have sex with a lower chance of pregnancy. This method may not be as reliable as using condoms, hormonal methods, or the copper IUD. It's difficult to get it right because everyone is different, so speak to your doctor if you're considering this. Withdrawal method. The withdrawal method is when the penis is taken out of the vagina before the man releases sperm at sexual climax. Even if only a small amount of sperm touches the vagina, it's still possible to get pregnant. Be aware that some sperm can be released before the man climaxes. This method isn't as reliable as using condoms, hormonal contraception, or the copper IUD. Emergency contraception. Emergency contraception, sometimes referred to as the morning after pill, is used when you're worried you might get pregnant. The copper IUD can also be used as emergency contraception. You might get pregnant if there is a broken condom, missed or late pills, or no contraception used. Speak to your pharmacist, doctor or nurse about options if you find yourself in this situation. The medication can be bought at a pharmacy and needs to be taken as soon as possible if it is to work. That is, within 4 or 5 days of having sex. Speak to your doctor about the copper IUD option. Permanent contraception. Permanent contraception is when a man or woman has surgery to make sure that they won't have children in the future. For a man, it involves cutting small tubes inside his body to stop sperm from being discharged during sex. For a woman, it involves clipping in the small tubes in her body to stop eggs moving into her womb. If you think there's a possibility you might want to have babies in the future, these might not be a good option. Be aware that some of the methods in this video are more effective at reducing the chances of pregnancy than others. If you're unsure which is best for you, speak